Okay, in this station we will discuss the greater sciatic foramen, and we will see the structures that passes through this very important foramen. Okay, as you can see here, this is the deep gluteal region, and this muscle, this triangular muscle, it is the piriformis muscle. And the piriformis, as we have explained in the previous station, it takes its origin from the middle three pieces of the sacrum, and it passes laterally to be inserted here in the greater trochanter. So this muscle provides the key for arrangement of the structures that passes from the pelvic cavity down into the lower limb. Okay, and any structure, in order to leave the pelvic cavity, it either exit the cavity above the piriformis muscle from here, or below the piriformis muscle from here. Okay, so before we go into the details and to demonstrate the structures, let us demonstrate the area of the greater sciatic foramen. Okay, this is the area of the greater sciatic foramen. Okay, and actually the foramen, like this, lies in the anterior posterior plane. It is posterior boundary, it is this ligament, it is the sacrotuberous ligament. Okay, and the anterior boundary, it is the greater sciatic notch, and it extends to the superior boundary, and it is inferior boundary in the sacrospinous ligament. So the sacrospinous ligament and the sacrotuberous ligament will cross like this, forming the greater sciatic foramen above and the lesser sciatic foramen below. Okay, so let us see the structure that passes above the piriformis. As you can see clearly here, this is the upper margin of the piriformis muscle, and here is the lower border of the gluteus medius muscle. You can see this artery, and together with this darker one, it is the veins. Okay, and we have another fine structure here. We have this the nerve. Okay, then we have the superior gluteal nerve and vessels, superior gluteal artery, vein, and nerve. All these three structures passes above the piriformis. Okay, regarding the superior gluteal artery, immediately it divides into two parts. Okay, the part that you can see here is the superficial branch. Okay, this is the superficial branch of the superior gluteal artery. It will supply the gluteus maximus. Okay, the other branches, here is the deep branch that passes between the gluteus medius and minimus. You can see here a series of structures. Okay, you can see here the darker one is the veins, and the paler one is the artery, and this deep one will divide into two branches, an upper branch and lower branch. The lower, called the descending branch, will pass into the trochanteric and cruciate anastomosis downward, and the upper branch will pass into the anastomosis around the anterior superior iliac spine. Okay, this is about the superior gluteal artery. The vein just following the arteries, and the nerve will supply the gluteus medius and minimus. Okay, regarding the structures below the piriformis, we have this nerve. It is one of the, or it's actually regarded as the largest nerve in the body, and this is called the sciatic nerve. Okay, the sciatic nerve, as you can see here, is the lower border of the piriformis muscle, and it exits at a point here. Okay, this point indicated by the surface marking between the posterior superior iliac spine and the tip of the coccyx, from midpoint from this line up to the tip of the greater trochanter. This indicates the lower part of the piriformis muscle, below which we have the exit of the sciatic nerve. Then the sciatic nerve itself, it is a mixed, or it is a nerve that it's formed by the tibial component and the common peroneal component from the lumbosacral plexus L4, 5, S1, 2, and 3 from 5 spinal roots. Okay, and this nerve, as you can see here, will pass straightly downward in the area between the ischial tuberosity here and the greater trochanter. And if you put a line between these two, it is found just medial to the midpoint of this line. Okay, and this is the surface marking of the sciatic nerve at the top of the posterior thigh. Okay, so in this from this mid area it passes downward in order to enter the posterior compartment of the leg, and we will follow this course in the next station. Okay, then the sciatic nerve, it is a very important nerve, and we have to avoid injure this nerve when we apply a gluteal intramuscular injection, and you have to avoid the area of the sciatic nerve. Okay, it is safely to be given in the upper outer quadrant of the gluteal area. So this is about the sciatic nerve. You have to know it's a surface marking, and regarding its distribution, we will see it when we will discuss further the posterior thigh and the leg. Okay, this is another nerve that lies on the sciatic nerve. Okay, it is found superficial to the sciatic nerve or on its posterior surface, and this large nerve is called the posterior femoral cutaneous nerve. And this nerve is actually, as its name indicates, it is a cutaneous nerve that supplies the posterior or the back of the thigh and the calf up to the mid calf. Okay, and it comes from the sacral plexus. Okay, it comes from the sacral plexus, from the posterior division, or the posterior division is 2, 3, or is 1, 2, and 3, and it will give this branch. It is called the perineal. Okay, perineal branch that will go to supply the skin of the perineum, and we have another branch that provide cutaneous innervation for the lower central area of the buttock. Okay, this is called the posterior femoral cutaneous nerve. Okay, then the sciatic nerve found laterally on its posterior surface, we have the posterior femoral cutaneous nerve. Then deep to this nerve, deep here, we have a smaller nerve, which is the nerve to quadratus femoris muscle that will enter the quadratus muscle and supply it. Okay, most deep you can't see here, it is the nerve to obturator internus that will supply the obturator internus muscle and the superior gemellus. Okay, medially here, okay, on the medial aspect of the obturator foramen, you can see this artery. It is the inferior gluteal artery, and the inferior gluteal artery will exit below the piriformis, and it will distribute to the gluteus maximus and other muscles of the region. Okay, then we have the other vascular structure. We have these internal pudendal vessels. Okay, these internal pudendal vessels cut it here, and it enters it exits below the piriformis and re-enter the perineal area here through the lesser sciatic foramen. Okay, in order to supply the perineal area, we have these internal pudendal vessels, and we can't see the internal pudendal nerve here, it is cut it. Okay, so in summary, we have some structures that passes above the piriformis muscle, namely the superior gluteal nerve and vessels. And below the piriformis, we have the most important structure. This is the sciatic nerve. You have to know it's nerve root and the surface marking, and plus we have the posterior femorocutaneous nerve, nerve to quadratus femoris, and nerve to obturator internus, and the internal pudendal vessels and inferior gluteal vessels. And this is what we can see in this station, and this is the end of this station.